Hi, I'm Madison Schrader and I'll be explaining the blood flow of the heart using this diagram here. Okay, first let's recognize each part of the heart. So first we have the superior and inferior vena cava, your right atrium, your tricuspid valve, your right ventricle, your pulmonary valves and artery, your lungs, your pulmonary veins, your right atrium, your bicuspid valve, left ventricle, aortic valve, aorta, and the rest of the body. Okay, so starting with the superior and inferior vena cava, that is where deoxygenated blood will be entering into your heart. It'll go through this here and enter into your right atrium. Once it's in your right atrium, it shall go through your tricuspid valve, and a valve is like a bus door almost like. So a bus door, it opens and lets kids in and out of the bus. But when it closes, it keeps it out, keeps kids in the bus or out the bus. Same with the valve, but with blood. Okay, once it goes through your tricuspid valve, it'll enter into your right ventricle, which is this here. And once it leaves your right ventricle, it shall go into your pulmonary valve and up through your pulmonary artery. And once it leaves your artery, it shall go into your lungs. Okay, now moving on to the left side here, it'll go into one of your 4 pulmonary veins, and once it goes through your veins, it shall go into your left atrium. Pretty much similar to the right side, except instead of the superior vena cava, it's a pulmonary vein entering into the left atrium instead of, yeah. And once it's in your left atrium, it shall go through another valve. This time it is a bicuspid valve. It's the same to the tricuspid one, opens and closes. And it'll go through your bicuspid valve into your left ventricle, same as it does on that side. Pretty easy to remember. Okay. Once it leaves your left ventricle, it goes into your aortic valve here. And there's a little, looks like a little cuppy thing. And it enters into your aorta. Once it leaves your aorta, it goes into the rest of your body to wherever it needs to go. Okay. Now some little tips and tricks to help you remember where everything is, everything goes, what comes first. Okay. So my first way to remember inferior and superior vena cava, of course it comes first because superior, you're number 1, right, when you're superior. So, and it's number 1 on the list. And without superior, you can't have inferior. Without inferior, you can't have superior. So, they go together, they are the first thing on the list. That is where deoxygenated blood enters. Next, your right atrium, or your atriums and your ventricles. The way I remember my atriums and my ventricles is, in the alphabet, A comes before V. And some people get it mixed up where ventricles and atriums are switched, but it's atriums come first before ventricles because A is before V in the alphabet. Once it goes through your ventricle, let's see. Oh, your tricuspid and your bicuspid valve. A way to remember it is like when you go to the store and you want to buy something, you try it on first. So your tricuspid valve comes before your bicuspid valve because you try it before you buy. Let's see. Your pulmonary artery. Once it goes through your artery, an artery starts with A, so A is away, artery means leave, away. So A for artery, A for away. It goes away from the heart and out into your lungs. Okay. And for veins, it's the opposite. So in veins, the word in is in the word veins. Like, hold on one second. Here's a pen. The word veins, V-E-I-N-S, literally has the word in it. So, veins is in and into your heart. And again, just both sides are the same. And I think that's it. Once it leaves your aorta, it is out. So, I think that is it on blood flow. So, thank you for watching. This is my demonstration on the blood flow of the heart.